Hi, my name is Trey Tashiro. I'm the Wellness Director here at South Metro Fire Rescue, and I'd like to show you around our Wellness Center and some of the treatments we provide.
So Matt's about 4 weeks post shoulder surgery, so while his shoulder's healing, he can't do a lot with that right arm. So one of the things we do with our firefighters is blood flow restriction training. So we can do that and work out his muscles at a much lower intensity. So he can see the same strength gains in his arm muscles that he could if he was lifting 70 to 80%. But with this, he'll only lift 20 to 30% of his 1 rep max. So we'll get Matt all hooked up there and calibrated and get him going. So in order to calibrate this to Matt, we want to figure out what his limb occlusion pressure is. So basically what pressure cuts off the blood flow to his arm. And then we want to work at 50%. So what we'll do is calibrate it just like a blood pressure machine. And while it's calibrating, it's important that Matt lays there quiet and still. All right, so now that we have Matt calibrated, we'll inflate the cuff. And whenever we're doing these exercises, our goal is for him to be totally fatigued with whatever muscle group we're working at the end. So as you can see, Matt's a pretty strong guy, and he's gonna do 7-pound curls here. And by the end, his arm's gonna be on fire. So whenever he does this, he does 30 reps, takes a 30-second break, and then does 3 sets of 15 with 30-second breaks in between each. So the BFR really can be used in conjunction with any injury, as long as they don't have any contraindications or risks for the use of the BFR. So we can use it with knees and shoulders and elbows. We see a lot of rotator cuff repairs, distal biceps, meniscus tears. So we use that in all those. Our goal is really to prevent atrophy while that joint is healing. So this BFR is great because we can keep their muscles strong but not load the joints to the point where the injury is going to exacerbate and allow it to heal.
So we're going to simulate just a little drag. So I'm going to come all the way down to the end of this hose, which you've done about 100 times. So we're going to shoulder this. I want to have you drag about 70 feet, kind of the length of the hallway here. Just going to pull it down. Once you get to that door at the very end, you're going to flip, and you can either kneel if you prefer, or you can stay upright. And then you're just going to drag it to you, turn around, and then come back down the hallway here. Perfect. So as you can tell, we've got Perry in his gear. So he's coming off a pretty long-standing injury. So we've restored his range of motion, we've restored his strength. So he's getting to the point now where we're going to clear him to go to work within the next 2 to 4 weeks. So what we're trying to do here is the NFPA standards, trying to check the 14 boxes of what the requirements of the job are. And of course, there are some things that we can't mimic here within this setting, but there are some things we can, and that's loading the tissue, getting him in his gear, having him move like he would do on a call. Obviously, we can't mimic the variables, the 12-hour, 24-hour, 40-hour work shift, but we can start training him in here. That way, when he does go back to that first shift or completing his fit for duty evaluation, he has gone through some of the movements that he would have to perform when he does return to the line. Perfect. All right. So let's go out in the stairwell now. Next part of the circuit. So what I'll have you do, Perry, you'll take these in the injured side, that right arm there. Carry those 3 flights all the way back down. So we'll mimic about 15 yards here, and just to simulate a little clamp slide. So go hand, right arm, just going to about 10 yards, and then flip, alternate knee and hand, and then bring it back. Perfect. And then we'll do a little simulated breach. Two rounds down and back, push it down, pull it back. And it's nice to get him in his gear and bunkers here, just because, as you know, that's extra weight, so more tissue load, but it also affects his movement pattern. So it's going to challenge him a little more than just having him go through this without the gear on, the pack on, the extra weight, but also restores his confidence, because he hasn't been in his gear in almost 12 weeks, I would say. So it's restoring some confidence and allowing him to get a feel again for what it's like to move and perform with all that extra load. And relax. Perfect.
So Eddie has some medial epicondylitis from lifting and from doing judo. And he's got some really hot trigger points in his elbow. So one of the ways that we treat that is with dry needling. So we use acupuncture needles, but it is not acupuncture. We are actually trying to find tight spots in his muscle to release it and increase the blood flow and decrease the spasm in his elbow. So we kind of palpate around and see where we feel the tender spots and where I feel like he has a little bit of a spasm. So do you feel that in there, Eddie?
No, that's okay.
How about
That's closer to
like that one?
a little bit. Yep.
That one right there. So once we find that little spasm spot, we clean his skin off and then insert a needle. And what we're really kind of hoping for with him, because I know I'm putting it right in the muscle, if I get it in the right spot, is sometimes he'll get like a little bit of a twitch reaction, and then the muscle will relax after that. So we just insert it in and then insert it into the elbow. Feel that, Eddie? Mm-hmm. And then take it out.
So we were just over at Wellness over in our mineral admin building. Now we're over at one of our stations. I'm going to complete one of the return to duty evaluations with one of our firefighters coming back from an injury. So before we do any trainings here at South Metro or any fit for duty evaluations, we always want to have them warm up to make sure they're ready to go for that training or for the evaluation. So we'll take Mark through a quick warm up here and get him going. So Mark, let's just start. We'll go knee to chest going down and foot to butt coming back. I'm ready. So we'll have you put your gear on like you're going on a fire call, get up on the engine, get the pack on, and then come out and we'll head over to the stairs. So when you hit that stairwell mark, we'll have you act like it's the hazardous environment. So at that point, it'll go on air and good job. You can leave the high-rise pack right there. Nice. Good, you can leave that right there. Go out the door there. Good. Good. Nice. Nice job, Mark. Good. 3, 2, 1. Good. 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 3, 2, 1. Good. Good job, Mark. So really our goal with the Fit for Duty evaluation is to look at all their body parts, going through the motions that they're gonna have to do when they go back to work that next set. Really our goal is to make sure that they're comfortable with doing the basic skills that a firefighter needs to complete. So if we look at the 14 essential tasks that NFPA outlines for firefighters, our goal is to hit as many of those as we can, if not all of them, through the rehab process and through this Fit for Duty evaluation. The other thing it lets us look at is just where their cardiovascular status is at. Like it doesn't dictate their return to workability, but it does give them a good baseline of how those skills feel and when they go back to work. Thanks for spending some time with us at South Metro Fire and Rescue Wellness, and have a great day.